these shirts, wheel patient 2 into the emergency room on a stretcher. The nurse in pink notes that the patient is deaf and calls for an interpreter who is dressed in the yellow shirt. The nurse will be sure to explain everything in a step-by-step fashion to ensure that the patient understands what is being done to treat them via the interpreter. During the interaction, the interpreter facilitates communication by converting spoken language into sign language. They convey not just the words, but also the tone and emotion of the communication, ensuring equal access to information and services. The nurse connects the patient to the vital signs monitor and EKG pads to monitor the patient's vital signs, including heart rate and rhythm. The patient's vital signs, such as blood pressure, respiratory rate, and heart rate, are high. However, that is to be expected because the patient is in pain. Since emergency medical services have already placed an IV, the nurse starts IV fluids and medications based on physician's orders. The nurse will then complete a head-to-toe assessment to observe for injuries. This includes a neuro check to look for a head injury. Because the patient is complaining of ankle pain, the nurse assesses the location and type of pain. Any abnormal findings will be communicated with the doctor so more testing can be done, such as an ankle x-ray. After the completion of assessments, the nurse can then administer pain medication through the patient's IV. This will help reduce pain and provide comfort during the x-ray examination. While we wait for the x-ray, the phlebotomist in dark red draws blood. The drawn blood will be taken to the lab where the technicians will analyze it to provide the medical team with critical information on the patient's status. The radiologic technologists in purple shirts have arrived and perform a requisition evaluation for a portable x-ray of the left ankle. They assess the situation and complete a mental plan of action. The technologists have all the supplies ready and explain the procedure to the patient via the interpreter. They position the portable x-ray machine for the left ankle x-ray while also determining the best technique for the examination. The technologist follows radiation safety protocol for the patient and personnel in the room. The technologist positions the patient for the first image. Then they reposition the patient to take a second image. The images are now evaluated on the screen in front of you. The doctor has ordered that the ankle be reset in the emergency room, which means that the nurse must obtain consent from the patient. The nurse will also sedate the patient and apply oxygen. The nurse and physician will work together to reset the ankle and apply the cast. Once the procedure is finished and the patient is awake and stable, they will be discharged with a family member. They will require rehabilitative care over the coming months. This is the end of care for patient number 2. Everything you just saw unfold would happen in a matter of minutes, and each medical professional would be performing their tasks simultaneously. Remember that everyone in these scenarios has a vital part to play. Everyone has to work together as a team to accomplish the proper care for each patient, because time is of the essence. This completes our trauma scenario. Once you get to the lab portion of today, you will get to participate in hands-on activities that play a role in our patient's recovery. Thank you all for watching the emergency room demonstration. We hope you had a chance to learn something new.
All right, thank you everyone. Give us a big round of applause for all of our coordinators and participants here. No one was harmed in the making of this. So now I'm gonna release you guys by groups. Group 2 had some extra participants added to it, so just make sure you